Yeah, so we have engaged Collective Medical to provide us with ADT notifications or admission, discharge, and transfer notifications. So we get real-time notification when one of our members presents to the emergency department or gets admitted to the hospital. And this has been particularly valuable in managing our most vulnerable populations. So by vulnerable populations, I mean individuals with increased risk for poor health status and poor access to health care, often leading to a greater than average risk for developing health problems and experiencing worse health outcomes. So they can fall into a number of categories such as racial and ethnic minorities, children and the elderly, LGBTQ status, the chronically ill and disabled, and individuals who live in certain geographic areas, for example, rural settings, which often have more limited access to care. Yeah, so I would have to get back to you about the exact percentage, but I will tell you that it's a very significant percentage of our population. Last year, we rolled out a new provider analytics tool that enables us to classify our members as very high risk, moderate, high risk, moderate risk, low risk. And the vast majority fell into the moderate to very high risk. Again, we have a lot of public sector programs, so these are very challenged populations.
And so Collective Medical is flagging for you discharges, just from the emergency room or the hospital in general.
Admissions to the hospital, discharges from the hospital, as well as patients who have an emergency department visit.
So that's a signal that you receive. So what sort of actions are taken when you receive this signal?
Yeah, so that is the value of having these real-time notifications, particularly for the emergency department, where often we might not be aware that one of our members has presented to the ED until a claim comes in, which could be 2 to 3 months after the date of service. So having that real-time notification really enables us to be aware of these patients and engage them while they're still at the hospital in order to address barriers to discharge or to decrease their risk of readmission by identifying some of those risk factors.
And in terms of working with the patient, is that something that Collective Medical is doing for you, or is this another entity, or maybe a group at Fallon that sort of the baton gets passed, or is this part of what Collective Medical is doing for you? Is when these people are identified, working with them, maybe in the period after hospital discharge and maybe after they leave the emergency department?
Yeah, so Collective Medical provides us with these real-time notifications, but along with that real-time notification, we have access to some very important information that we might not otherwise have from eligibility and enrollment. So for example, even something as fundamental as having a valid phone number, this is particularly important for our Medicaid population, having other demographic information, again, that may not have been captured at the time of enrollment. And that's really been invaluable. We have a very robust clinical integration team, which comprises nurse case managers, social workers, navigators who function similar to community health workers. We even have a pharmacy team we call Safe Transitions that will go into the home and do medication reconciliation. And so when we learn of these patients, we can immediately assess their situation and identify what sorts of services they might need, what types of interventions we might need to bring to bear, again, in order to keep them safe in the community and keep them at home. No, the timing was very fortuitous. We had started engaging with Collective Medical in late 2019. as part of this broader strategy, really to provide a continuum of services to keep our members safe in the community. So just prior to the pandemic, we had actually started embedding navigators in our high volume hospitals to help manage some of these transitions of care. And the implementation of the collective medical initiative was very timely because it's enabled us, as I mentioned before, to more proactively manage members and avert unnecessary ED visits and avoidable hospital stays. And now that we have temporarily removed our embedded navigators from the hospital, it's given us a very powerful tool to identify these members and to continue to intervene. We're also hoping to reduce racial disparities by addressing the social determinants of health, which for many of our vulnerable populations can actually be as impactful, if not more impactful, than the medical care they receive. So this has really been very instrumental in helping us to address all these issues.
And I assume the embedded navigators were taken out of the hospital because of COVID-19.
Yes, the hospitals asked us to remove them, but they were very excited about the program. We also had navigators embedded in some of our high volume primary care practices, very well received, particularly because they did have a very strong focus on addressing the social determinants and other barriers.
So I assume that Fallon and Collective Medical have some metrics in place to measure the effect of this effort. So could you tell us a little bit about those metrics and what sort of timing are you going to use to sort of assess it? Is this working? Is this having an effect?
Yeah, so we just launched this program a month ago, so still too early to report out on metrics. I can tell you though, anecdotally, we are seeing some really amazing success stories. Just yesterday, one of our navigators enabled a patient to return home by addressing accessibility issues. This was an individual who was reliant on a wheelchair for mobility and had steps leading up to his home. Our navigator was able to arrange for home modifications and installation of a wheelchair ramp. We will be looking at objective data at the 6-month mark, the 12-month mark. So metrics around avoidable ED visits, hospital readmissions. But in the meantime, again, anecdotally, we're just seeing some really amazing success just by virtue of early notification of these members presenting to the ED or getting admitted to the hospital and being able to intervene much further upstream to address many of these social determinants.
Do you have any sense, just from these early results, anecdotes, not they're anecdotes at this point, not data, but still, anecdotes and stories, we're attracted to them at the very least. What sort of upstream measures have the greatest consequence, the greatest effect? I mean, we're all, or everybody in managed care is dancing the social determinants of health dance these days, but I'm not sure whether we know, given that the social determinants of health are sort of a tangled welter of factors.
Right.
What to intervene on exactly? What because it's usually a big complicated puzzle. So do you have any sense, what's working?
Yeah, and I share your frustration. Sometimes it's very difficult to measure the impact of something you're preventing in the future, right? But there are certain interventions just through our years of having in place this very robust clinical integration model that we are aware can be very impactful. So things as simple as helping our member to set up a post-discharge office visit or telehealth visit with their primary care provider. I mentioned before our team of pharmacists who will do medication reconciliation. There are other types of interventions which we've also found to be impactful, linking individuals who are at risk of homelessness with local community resources, referring members with food insecurity to local food banks. We also have a very robust process for assisting with transportation, which can also often be a significant barrier for some of our most vulnerable populations. Really trying to get members comfortable with telehealth as well, and telebehavioral health, in particular during this pandemic. I've been very gratified to see that many of our members are availing themselves of tele-BH services, which is so important. And really addressing, as I mentioned before, other barriers. So I talked about home modifications. Our navigators will often help our members obtain durable medical equipment in a timely fashion, and really with the goal to keep them in the community and keep them safe in their own homes.